Followed by Bryan Ludwig of the Chiropractors Council, and quite frankly, I'll need an adjustment before the evening is over. Next speaker is Bryan Ludwig, New York Chiropractic Council, followed by Susan Milnick, New York State Nurses Association. Okay.
Good afternoon. I'm not only a volunteer as district president for the New York Chiropractic Council, I'm also a practicing doctor of chiropractic in Schoharie County. And I understand last year you asked for an adjustment, and this year you asked for an adjustment, and I am quite good.
Okay, all right. I may
So,
take you up on it this year.
The New York Chiropractic Council's mission is to direct people to the realization that healing comes from within each of us, and that ultimately promoting health and wellness is going to be superior to treating disease. So, and our purpose is to promote this basic philosophy, science, and art, as well as to protect chiropractors in New York State. I'm glad that we've had a couple of our members on the health exchanges, Dr. Robert Brown and Dr. John LaMonica. Last year I sat here and I had the privilege of testifying before you, and I listened to the testimonies of many other caring, effective organizations, and there was a lot of concerns. And I kept thinking, how could we solve that as well as work within a budget? I mean, across the board, people are saying, okay, we need more funding. Pharmacists are saying, geez, I'm having trouble selling drugs. It's set at a certain price, it's staying in business, need more beds. Hospitals need to be able to fix infrastructure. How would it be better if there were less sick people and we spent less on it? There'd be more in the budget.
Preventative care.
What's that?
Preventative care.
Absolutely.
Okay.
And by prevention, that's a buzzword. We say prevention, so we might think, oh, let's do this blood test for prostate cancer. You know, and I've had a lot of discussions with others in my profession. That's not prevention. The disease is already there, so you haven't prevented it. You found it early, but you didn't prevent it. So, I mean, I submitted to you, Senator, a very large packet of many, many studies, 140 pages. We didn't kill all the trees to give 40 copies of that. So one of those I wanted to go over because it seems just common sense. You know, keep people well, and there's less need for funding to treat the consequences of poor health. So this one large study in Chicago, Illinois, in 1999, for 7 years they did this. They wanted to test, and I'm going to tell a little story and then we'll give you the punchline. For 7 years they wanted to test the effectiveness of one drug versus the treatment, another kind of treatment. What they did over 7 years, and just looking at in-hospital admissions, they decreased by 60%. I guess there were fewer sick people. There were 59% less hospital days. There were 62% less outpatient surgeries and procedures. And they spent, this insurance company spent 85% less on their pharmaceutical costs. Now, we're not talking 1%, 2%, you know, something that in a study you can statistically, you know, manage or massage to make it look good. These are huge numbers. So I went back and I looked at, the earliest year I could look at was 2012 for the New York State Health and Medicaid budget. Got that online. And on 3 line items, inpatient, hospital, outpatient, drugs and surgery, we spent $7 billion last year. So for these 3 line items, if we follow the lead of this insurance company, Alternative Medicine, Inc. was their name, we could say the budget as much as $4.5 billion. Yeah. So I'll say it again, it could save us $4.5 billion. And I didn't want to just sit here and say, hey, you know, prevention's great, we should do it. Here's something that has taken the lead and has done it. So I know you want to know, what did they do? They just switched one drug for treatment B. Well, treatment B wasn't a drug, it was chiropractic care. So they had chiropractors that were managing patients, and they could call, say, hello, Mr. Medical Doctor, I have this case I had some advice on. So the result of this was less drugs, less surgery, and less procedures. Not because they didn't need it, they were healthier. So New York Chiropractic Council would like New York State to know, it's a simple fact, when people become healthy, they no longer need drugs, they no longer need surgery. And when sick people become well, our budgets balance. I saw some big eyes up there. I don't know if you had any questions for me.
No, they're just big eyes thinking maybe you're done. Not that what you said was not important. I just caught the pause.
I understand.
Okay. No, I appreciate that. And no one has any questions, correct?
We look forward to being a resource if you have questions.
I appreciate that, and I remember the report. But thank you.